Health and hygiene. When one or more organs or systems of the body fail to function normally, that state is called disease. In humans, all the diseases can be classified as congenital diseases. Congenital diseases or birth defects are disorders that are present at the time of birth. Acquired diseases. These are the diseases which develop after the birth. On the basis of cause of spreading, the diseases can be of two types. 1. Communicable or infectious diseases. 2. Non-communicable or non-infectious diseases. Communicable diseases. The diseases that spread from one infected person to another healthy person are called communicable diseases or infectious diseases. Microscopic organisms, also called germs, cause the diseases. The microorganisms include bacteria, virus, fungi, and protozoa. The diseases caused by the microorganisms have been summarized in table. Diseases caused by microorganisms. Disease, symptom, prevention. Bacteria. Diphtheria, an acute and highly infectious disease affecting children, characterized by the formation of a false membrane in the passages of the upper respiratory system. Throat pain and cough, glottis is blocked and breathing becomes difficult, high fever. Patient is to be kept isolated. Liquid diet should be given. Boiled water for drinking. Vaccination. Cholera, epidemic disease caused by contamination of food and water. Spreads through germs carried by housefly. Vomiting and thirst, acute diarrhea, pain and fatigue, suppression of urine and dehydration. Boiled and saline water for drinking. Onion and mint juice should be given. Antibiotics and immunization. Tuberculosis, acute bacterial infections that primarily attack the lungs but may also affect the kidneys, bones, lymph nodes, and brain. Coughing, chest pain, shortness of breath, loss of appetite, weight loss, fever and fatigue. Tubercles are formed in affected area. Complete rest, balanced diet, improved hygienic conditions, BCG vaccine, antibiotics. Typhoid, spreads through water, food, or diseased patient. Prolonged continuous fever, headache and uneasiness, slow pulse, small white eruptions appear on the body. Complete rest, complete isolation, milk and fruits diet, use of antibiotics, vaccination. Virus, cold, most common viral disease, spreads through contact or droplet infection. Coughing, sneezing. Headache, throat pain. Cough and fever with body pain. Complete rest, vitamin C should be given to increase resistance. Tea of ginger and tulsi. Polio, infectious viral disease that sometimes results in paralysis. The infection chiefly affects children. Infection can result in permanent paralysis of limbs. Polio vaccine. AIDS, acquired immune deficiency syndrome. Caused by HIV, human immunodeficiency virus, spreads through sexual contact or infected syringes. Weakens the body, weakens the immune system. Antiretroviral therapies, post-exposure prevention, anti-HIV drugs, testing the blood for AIDS virus before transfusion. Chickenpox, caused by varicella zoster virus. The virus spreads through the air via infected droplets. Weakness, mild fever, rashes and blisters on the skin. Sanitation, isolation and prevention. Application of antiseptic cream. Lukewarm bath. Fungi, ringworm and itch, caused by mycelium of the fungus below the epidermis of skin. reddish spherical spots on the skin. Spots produce itching. Increases with moisture. Bath with antiseptic water. Local application of antifungal creams. Baldness caused by hereditary factors, aging and reaction to drugs. Partial or complete loss of hair. Baldness may spread over the entire head or it may occur only in spots. Use of antifungal cream. Transplant of hair. Protozoa. Dysentery. Acute and chronic disease of the large intestine of humans, caused by antiamoeba or some bacteria. Spreads through contaminated food and water. Frequent watery stools, sometimes containing blood and mucus. Dehydration. Proper sanitation. Food articles should be covered from dust and flies. Use of suitable drugs. Malaria, caused by Plasmodium, transmitted from person to person by the bite of female Anopheles mosquitoes. Chilling, shaking, periodic high fever and acute headache. Use of mosquito net or repellents. Control of mosquito breeding. Use of anti-malarial drugs such as quinine. Common communicable diseases. Some common communicable diseases, their symptoms and treatments are given here. Influenza. Influenza is a highly contagious viral disease. It results in flu epidemic. Symptoms. It affects the upper respiratory tract, nasal congestion and dry throat. Patient feels chills, fatigue, headache, pain in chest and joint. Treatment, bed rest, adequate fluid intake is must. Medicine aspirin should be given for fever and muscle pain. Measles, rubella. Measles is a common childhood disease caused by a virus which is highly communicable. Measles is usually spread by droplet infection and invasion is through the respiratory tract. Symptoms, eruption of small red spots, rubella, inflammation of the mucous membrane of the nose. Treatment, Schwartz vaccine includes immunity against measles. Nowadays, children are vaccinated after 15 months of age with combined vaccine called MMR. Measles, mumps and rubella. Dengue fever, breakdown fever. Dengue fever is caused by an RNA virion of the flaviviridae that multiplies in white blood cells and platelets. It is a tropical virus disease spread by the tiger mosquitoes. It is one of the dangerous diseases can and be detected by tourniquet test. Symptoms, high fever, frontal headache, pain behind eyes, muscles and joint pain, loss of appetite, nausea and vomiting, platelet counts slow down, measles-like rashes over chest and upper limb. Patient often reports sensation that their bones are breaking, hence named as breakbone fever. Treatment, elimination of mosquitoes. Adequate fluid intake is must with coconut water and fresh juices. Platelet transfusion. Chikungunya. The name chikungunya is derived from the Makonde word which means that which bends up, a reference to the stooped posture that develops due to arthritic symptoms of this disease. It is caused by buggy creek virus. Till date, no vaccination is available. Symptoms, headache, fever, fatigue, nausea, vomiting, muscle pain, rash and joint pain. Treatment, painkiller for joint pains. Patient should be given paracetamol to reduce fever. Malaria. Malaria is a mosquito-borne disease caused by a protozoan blood parasite called Plasmodium. Female Anopheles mosquito spreads the disease because when mosquito bites the patient, these parasites enters mosquito's body and undergo further development. The parasite multiply there and stored in their salivary glands. When these mosquitoes bite a human, the parasite introduced into human body. Symptoms, shivering fever, headache, nausea, joint pain. Treatment, bed rest, elimination of mosquitoes, liquid diet, proper dose of quinine as prescribed by doctor. AIDS, acquired immune deficiency syndrome. AIDS was first reported in the USA by Dr. Gilolib in 1981. It is caused by the HIV virus, human immunodeficiency virus. HIV is very fragile virus. It cannot survive long periods of exposure outside the body. It spreads by sexual contact and contact with blood. The sharing of blood-contaminated needles is also one of the major causes. Even patients receive blood for treatment of medical illness, including packed red blood cells, white blood cells, platelets, etc., may also be at the risk of HIV infection. Transmission of HIV from the mother to the newborn may also occur. Symptoms: swollen lymph nodes, fever, weight loss, weak immune system. Treatment: vaccines are not available. Treatment of AIDS with antiretroviral drugs is only effective. They can only prolong the life of the patient but cannot prevent death. Mode of transmission of diseases. The communicable diseases may be transmitted through these methods. Microorganisms. The diseases caused by the microorganisms have been summarized in the table. Contact. Some pathogens, something that can cause disease, spread from one person to another by direct contact, through body openings, mucous membranes, skin wounds, and they enter the second person through similar channels. For example, skin diseases, conjunctivirus, eye infection, lice, leprosy, AIDS, chickenpox, etc. Droplet infection. The germs of the diseases are transmitted through saliva, coughing, sneezing, and spitting. The viruses that cause respiratory diseases, such as influenza and the common cold, spread through moisture droplets when an infected person coughs or sneezes. A hand that was used to cover the mouth while coughing contains viruses that may be passed to doorknobs so that the next person when touches the doorknob has a chance of picking up the infectious agent. For example, cough, cold, tuberculosis, influenza, etc. Inoculation into skin. Many microorganisms may be inoculated directly into skin, such as rabies virus by biting of dog, hepatitis B virus through contaminated syringes, etc. Food and water. These are another important agencies to the spread of diseases. Many pathogens spread through contaminated food and water. The pathogens of cholera and typhoid spread through food and water contaminated with the excreta of infected people. Vector. Flies, mosquitoes, or insects cause some diseases, example, malaria, dengue, etc. The malarial parasite, for example, spends part of its life cycle in mosquitoes. When the mosquito bites the person, it enters a person's bloodstream. Other examples are filaria, plague, by rats, yellow fever, viral, etc. Prevention. Adopting these habits. One can control communicable diseases. 1. By consuming clean and safe water. 2. By eating fresh and warm food. Keep the food always covered. 3. By inhaling fresh air. 4. The utensils of infected persons should be washed by hot water. Healthy persons should not use these utensils. 5. By washing the hands frequently with medicated soap. 6. Use mosquito nets or repellents to protect from mosquitoes. 7. Vaccination course should be followed. Non-communicable diseases. These diseases are not communicated from one person to another. They are either congenital or acquired diseases or due to the malfunctioning of any of the organ of the body. For example, rickets, hypertension, arthritis, cancer, and heart disease. Degenerative disorders, including arthritis and Parkinson's disease, involve the breakdown of tissues and loss of function of parts of the body. Joints gradually become stiff, bones become brittle, blood vessels become blocked by the deposition of fat. The incidence of these problems increases with age. Adopting good health habits can slow down such degeneration of body parts. Non-communicable diseases can also be caused by the deficiency of certain nutrients. Harmful effects of bad habits. Some people consume alcohol, drugs, tobacco, opium, and cannabis, bhang, which affect the body adversely, causing several types of diseases. Some of these are described here. Alcohol. Use of alcohol is harmful to health. Excessive use of it makes the entire body unconscious for a certain period, which shows their effects on central nervous system. With the circulation of blood, alcohol reaches the brain and body becomes unconscious, causing indigestion, liver trouble leading to cirrhosis. Alcoholic drivers have more chances of road accident because their mental balance is disturbed. Harmful effects of alcohol. Percentage of alcohol in blood. Effects. 0.02 mild alterations of feelings, slight intensification of moods. 0.05 feelings of relaxation, giddiness, lowered inhibitions. Judgment and motor skills are both slightly impaired. 0.08 muscle coordination and reaction time impaired. 0.10 clumsiness, uncoordinated behavior, impairment of mental abilities, judgment and memory. 0.15 irresponsible behavior, some difficulty in standing, walking and talking. 0.20 motor and emotional control centers measurably affected, slurred speech, staggering, loss of balance and double vision. 0.40 drinker is usually unconscious. 0.45 respiration slows and can stop altogether. 0.5 death may result. Drugs. Drugs that are used nowadays in most of the cases cure certain diseases, but sometimes they show harmful effects. Many people use drugs at random without consulting physician. Self-medication has sometimes proved to be dangerous. Some people use drugs to relieve stress and to forget about their problems. Drug abuse is characterized by taking more than the recommended dose of government-controlled substances such as marijuana, cocaine, heroin, ether, tranquilizers, and isohydrazine. Abuse of drugs and other substances can lead to physical and psychological dependence. Drug abuse can cause a wide variety of adverse physical reactions. Long-term use of drug may damage the heart, liver, and brain. Drug abusers may suffer from malnutrition if they habitually forget to eat, cannot afford to buy food, or eat foods lacking the proper vitamins and minerals. Individuals who abuse injectable drug risk contracting infections such as hepatitis and HIV from needles shared with other infected abusers. Tobacco. Use of tobacco is injurious to health, which affects the nervous system. Tobacco contains nicotine, an addictive drug. Tobacco that is smoked by cigarettes, pipes, and cigars causes lung cancer and other respiratory diseases. Smoking also contributes to heart disease. Chewing tobacco and inhaling snuff cause cancer of the mouth, nose, and throat and can lead to nicotine addiction. Smoking causes nearly 90% of all lung cancer cases. Inhaled tobacco smoke also injures the tissues of the mouth, throat, and larynx or voice box. Smoking also causes health problems in non-smokers. Each year, about 3,000 non-smoking adults die of lung cancer as a result of breathing the second-hand smoke from other cigarettes. Passive smoking. First aid measures. Most of the times we follow safety rules. Even then sometimes accidents and mishappenings can take place. Children, while playing, may fall down and get injured. In your home, any family member may fall sick. In such an emergency, care for a victim of sudden illness or injury is called first aid. In our daily life, all of us must have the basic knowledge of first aid. For a variety of injuries like cut, bruises, burn, and stings, we need prompt aid before reaching to the doctor. In emergency, These steps can be adopted for few for the injuries. Burns. A burn is an injury to the skin caused by exposure to fire, hot liquids or metals, etc. Burns are classified according to the depth of tissue damage and extent of the burn. 1. First-degree burn or superficial burn. It involves only the surface of the skin, is characterized by reddening. 2. Second-degree burn. This type of burns extends beneath the surface of the skin and causes blistering and severe pain. 3. Third-degree burn. It causes charring and destruction of cell-producing layer of skin. Severe burns cause shock and loss of body fluids. A person suffering from third-degree burns should be hospitalized as soon as possible. First aid for burns. 1. Remove the source of burn as soon as possible. 2. If clothes catch fire, roll on the ground or wrap the victim in a blanket. 3. The burn area should be cooled immediately with cold water. A clean, cold wet towel can be placed on less serious burns. 4. When small swellings on the burnt area, blisters are formed, dip the affected part in water. Do not puncture the blisters. 5. On severe burning, cover the body with clean cloth and rush to the doctor. Cuts. 1. Wash the cut with soap water. Dust particles should be removed. 2. Cut part must be disinfected by antiseptic solution. 3. To stop the bleeding, apply pressure directly over the wound, tie a bandage, and if possible, elevate the bleeding part of the body. Bruises. 1. Bruise is an injury in which tiny blood vessels beneath the skin are ruptured, but the skin itself is not broken. The affected area swells and turns shades of blue, red, and purple as blood from the broken blood vessels seep into the tissues. 2. Swelling and pain may be lessened by applying either ice or cold, wet cloths to the affected area immediately after the injury. Animal bites and stings. Animals like snakes, dogs, cats, and certain insects may bite humans, which may result into dangerous consequences. Snake bite. The snake bites by non-poisonous snakes do not require treatment beyond cleaning the wounds. Bites of poisonous snakes require immediate first aid measures. Tightly bind the area to prevent the venom from spreading rapidly through the individual's bloodstream. The wound should be washed thoroughly with soap and water. The victim should be taken to the nearest hospital as soon as possible. Bites from other animals should be thoroughly washed and an antibiotic ointment should be applied. The victim should seek medical help and anti-rabies injection must be given. Stings. Bites from insects like fleas, mosquitoes, bees, etc. should be washed to prevent infection, and cold compresses are applied to alleviate itching and pain. Remove the stings with the help of forceps. General precautions of first aid. 1. Do not panic or get frightened. Keep calm. 2. Do not crowd around the victim. 3. If the person is badly injured, immediately rush to the doctor. 4. While giving first aid, it is very important to know what not to do in an emergency. Wrong treatment can be harmful to the victim. Prevention of diseases. The diseases of humans can be prevented up to some extent by adopting certain precautionary measures. Personal hygiene. The diseases are the part of our life, but by adopting several habits, we can reduce them. Hygiene is the science to maintain cleanliness and health. The important factors of personal hygiene are exercise and rest. 1. Regular exercise increases the general physical and mental health. It is good for people of all age groups. 2. Morning walk and yoga exercises are good for adults and aged people. 3. Children should play outdoor games. 4. Running, swimming, jogging, skipping are other exercises to be followed. 5. Every living being needs rest to recharge them. 6. We get perfect rest during sleep. 7. A healthy man requires 6 to 8 hours of good sleep daily. Children need more sleep for their good health. Personal cleanliness. We need our body, clothes, house and surroundings to be cleaned thoroughly and regularly. In dirty conditions, many germs attack and chances of infection increases. These infections can cause diseases. Personal cleanliness is most essential for good health. To maintain a good health, these suggestions should be adopted in our daily routine. 1. Wash your hands frequently. Before taking meals, hands should be washed by soap. 2. After taking meals, wash your hands and brush the teeth to remove small food particles. 3. Regular bath must be taken to clean the skin and entire body with a good mild soap. 4. Change your undergarments daily and if possible other garments too. 5. Keep the nails short and clean. 6. Eyes should be washed by clean water twice or thrice daily. 7. Ears should be protected from dust. Do not use matchsticks to remove the wax. Soft medicated buds should be used to clean the ears. 8. While studying, always sit in the right posture. Keep a distance about 40 centimeters from the book to the eye. Healthy habits. Good habits keep a person healthy. Many good habits should be adopted. 1. Smoking and drinking of alcohol must be avoided. 2. Proper control over emotions such as anger. 3. Food should be taken at regular intervals. 4. There should be a reasonable gap between dinner and sleeping. 5. We should breathe from our nose. Cleanliness of surroundings. Public hygiene. Most of us keep our home clean and maintain the hygienic conditions. Some of us have uncleaned personal habits which make it difficult to maintain a healthy environment. You may be clean, eat balanced diet, and have happy atmosphere at home, but your neighbor may dump garbage in the open. The drinking water supply may not be clean. These unhygienic conditions may produce disease causing microorganisms and you may get infected and fall sick. Thus, unhygienic personal habits can create health problems for you and the entire community. These precautionary measures should be followed for the health of the whole community. 1. All public places such as school, office buildings, bathrooms, laboratories, cinema halls, etc. should be kept clean. 2. The eating places such as hotels, restaurants, dhabas and their surroundings must be kept clean. All eatable items must be kept covered. 3. All public drains and garbage must be covered and some disinfectants should be used. 4. The water should be kept free from germs and microorganisms by using chlorine or bleaching powder. 5. Spray the disinfectants over the stagnated water so that the mosquitoes do not breed over there. 6. For sewage disposal, proper dumping methods should be followed. Waste materials should be dumped in pits, techniques of composting and sewage treatment plants should be installed. 7. Avoid defecating in the open. 8. Trees should be planted. Defense system of the body. Despite of taking all the precautions to prevent diseases, sometimes you have to face certain unhygienic conditions. Do you know why you don't fall sick at all the times? To protect us from infections, our body is blessed with self-defense system. The different parts of this are skin. It covers the entire body and acts as a barrier and checks the entry of germs into the body. Nose. It has mucous membranes and hair which controls the entry of foreign material. Eyes. Tears help in washing of the eyes. They have isozyme, an enzyme that kills the microorganisms and protects us from foreign matter and infection. Stomach. The microorganisms which reach up the stomach are killed by the hydrochloric acid present in the stomach. Blood. While blood cells and leukocytes of the blood destroy the microbes. Immunity. Our body has another system of defense against diseases called the immune system. The health of the body is dependent on the immune system's ability to recognize and then destroy these invaders. The ability of a body to resist a particular disease is called immunity. When a foreign body called antigen enters our body, the immune system makes proteins called antibodies. These antibodies attack the foreign body and by destroying them defend us from diseases. Antigen. These are foreign body that evokes the production of an antibody when introduced into the body of an animal. Antigens can enter the body through the respiratory tract, digestive tract, skin, or blood vessels. Antibodies. The immune system produces proteins called antibodies in response to the presence of a foreign body. These antibodies kill the antigens. Vaccination. Vaccination or immunization is a method of developing resistance in the human body to specific diseases using microorganisms such as bacteria or viruses. These treated microorganisms develop the immune system to build a defense mechanism that guards against the disease. If an immunized person in future comes in contact with the disease-causing agent, the immune system is immediately able to respond defensively. Vaccination has reduced the incidence of a number of deadly diseases. For example, smallpox. Vaccines for different diseases are given to the children as per the plan given in the table. Vaccination plan for the child. Disease time schedule. DPT. 3 doses at 1 month interval between 3 to 12 months of age. Booster dose between 18 to 24 months. Polio. 3 oral doses at 1 month's interval in first year. BCG. Once at birth. Influenza. Before 2 years of age. Measles. 1 dose between 9 to 15 months of age. Hepatitis. 3 doses at 1 month interval after the age of 1 year.